Okay, so let's talk more on malnutrition, in particular PEM, protein energy malnutrition. So this is where we are deprived of protein and therefore energy, which is a state of starvation. And alarmingly, 1 in 4 children are in a state of starvation around the world, but some adults are as well. And what we have here is the loss of body composition due to the starvation. This could happen for a very short time, or it could happen progressively over a long period of time. Now, what are some examples of a long period of time? It could be alcoholism, as opposed to a famine, which might be a 3-month period. Now, starvation can present as 4 types: marasmus, kwashiorkor, combination of both, or cachexia. Let's talk about marasmus first. Now, please note, marasmus and kwashiorkor have different age groups. So this presents in infancy, 6 to 18 months of age. These are infants. So these children have been severely deprived or have impaired absorption of protein, energy, vitamins and minerals, the whole lot. So again, proteins are the last to go in a state of poverty. And this develops quite slowly. So this has really been happening since the beginning of this child's life. They have severe weight loss, muscle wasting, including the heart, which is very, very dangerous because the heart is almost entirely muscle and protein. They are less than 60% of the weight they should be for their age, and there's a lot of anxiety and apathy. So these children are very flat. They have a good appetite if there is food though, and they have hair and skin problems. With hair and skin is predominantly protein, or at least hair is, and skin has a lot of protein, especially the connective tissue underneath skin. So when hair and skin is starting to show signs of protein deficiency, we know that we've been in a state of starvation in terms of protein intake for some time. So it's really the chronic protein deficiency states where you see hair and skin problems. Before that, you'll see loss of muscle tone. And then kwashiorkor is a little bit different. These children are older, 18 months to 2 years of age, and this happens due to lack of protein or infection. And again, infection will prevent protein uptake in the stomach and small intestine. There's some muscle wasting and fat retention. The growth is 60 to 80% only of the weight for age. Now, kwashiorkor is marked by a swollen abdomen. And that swollen abdomen occurs because the liver enlarges, and when that happens, we get edema in the abdomen, and it's very similar to what alcoholics get when they get a beer gut. There's apathy and misery, so they're very flat and very irritable, and there's no appetite. So this is the difference. These kids are a little bit older and have no appetite. It's hard to tell the difference without visually seeing the swollen abdomen because they also have hair and skin problems. I have not seen a child with marasmus or kwashiorkor in Australia, but I have definitely seen it overseas. Now, cachexia is an old-fashioned word, and it's very similar to the state of anorexia, but we wouldn't necessarily use cachexia as a word in medicine commonly. So this is when we have multi-organ, multifactorial wasting. And this is what happens when you get cancer. So when you have someone in the later stages of cancer, we know in the beginning they'll lose weight, but sometimes when they lose weight, people tell them they look fantastic. And then when the cancer's advanced and they're closer to the end of their life, they will go into cachexia. So this is what when we say they're wasting away, and this is quite frightening if you've ever known a cancer patient in advanced stages. And then we have a whole lot of other serious illnesses, including coronary heart disease and chronic pulmonary disease. It's potentially irreversible if you don't get it in its early stages. Now, unless the cancer patient goes into remission, the cachexia won't go away. So we have the loss of muscle tone, fatigue, weakness, loss of appetite, early satiety, so they're full all the time, and they're losing weight when they're not trying to. So even if they were eating a significant amount of calories in their diet, they're still losing weight, which is why weight loss is such an alarming symptom if you're mature age and you're not dieting. So mild to moderate deficiency of protein. Now this is much more common in our society now, because we've had a big trend towards vegetarian and plant-based diets and veganism. These signs can fly under the radar, so please be aware that you can have mild to moderate protein deficiency and you may not even know it. Your client may just notice these symptoms, but they're not life-threatening usually, so they may not be taken as seriously as what we would hope. So protein deficiency, frequent infections. Now, there's a lot of reasons why you'd have frequent infections. So you don't always think protein deficiency. You might think of iron deficiency, lack of exercise. You might think of zinc deficiency, selenium, vitamin C deficiency. So protein's just one of the many reasons. But this is quite common in athletes. So in the Olympians who are overtraining, they can easily become protein deficient and after their events be very susceptible to infections. And I often wonder if with teenagers that are over-exercising and not eating properly, I often wonder whether this is one of the causes of glandular fever. Probably the more obvious one would be a zinc deficiency due to all that growth. But if you think about it, a 15, 16-year-old teenager is probably exercising a lot, probably not eating all that well, and they're going through a rapid period of growth. So it's quite easy to become mildly deficient and therefore be vulnerable to those types of viral infections. If you get bloating after food, bloating is a sign that you're not digesting your proteins well. So you really need to look into your stomach and small intestine function. If you have poor muscle tone, low blood pressure, brittle peeling nails and hair, now there's a lot of reasons why that could happen, but it's one of them. If you have anemia, or if you have poor kidney function. These symptoms as a whole are very, very common. So you really want to know these well and remember them. Protein toxicity. What happens if you have too much protein? It doesn't happen a lot, but it can happen in the fitness industry. They can get too little or too much. So for people who are undergoing a training regime in the world of fitness, they can consume too much protein. And it's only too much for your physical capacity or too much in relation to the amount of exercise that you're doing. However, we're not really sure how much too much is, so we don't really know what the upper limit is. If you have kidney disease, you can't utilize your proteins well, so it's too much work for the kidneys and they get worn out. So if you have a high protein diet because you're training for Olympic events for long periods of time and it's too much for what your needs are, it puts a strain on the kidneys. Now, there are people who are not exercising and still having too much protein, and there's various reasons why this is a problem, and we'll go into it. Too much protein can give you osteoporosis, and that is because too much protein can excrete calcium, and that's very unfortunate. You can give yourself heart disease, especially when you're overeating animal proteins that are high in saturated fat. Cancer is traditionally thought to not respond well to red meat, but we now know that's not exactly true. If you have too much red meat, and in particular processed meat like ham and sausage, without the fibre, that's the key. There is a link to colon cancer. So it's not exactly true to say red meat causes cancer, but it's if you bulk out your diet with red meat and processed meat and you push out the vegetable component and the fibre component, that can lead to colon cancer. So, the controversies around protein. So, let's talk about protein supplements. Some of you have had them, some of you have not. Now, you can use protein supplements to bulk up muscle tone and to potentially give you energy, or you can use protein supplements to lose weight. Either way, you're usually on very similar supplements. So we use these supplements to increase skeletal muscle synthesis, and that is usually post-exercise. So we replenish the protein we need with protein powders after exercise. Don't do it during, because you're not going to get anything out of it during. Okay, the only thing you should be taking during exercise is carbs. If you take protein supplements without exercise, the protein may be burned for energy or stored as fat. So just be careful having too many supplements, because if you don't need the protein and you don't burn it as energy, you will convert it into fat. Protein supplements will increase your nitrogen excretion, which is a problem for your kidneys, like we just said, and it may alter calcium and bone metabolism if you have too much. And again, this is too much over a long period of time. Right? And if you're doing it for weight loss, you really should only be doing it for, several weeks. The purified protein powders lack other nutrient components found in foods. So when we eat a whole protein, there's not just protein in that food. Let's take a block of cheese. Okay, so there's not just protein in that cheese. There's calcium and B vitamins and fat, etc. So you can't really replace a meal with a protein powder for too long, or you're not doing yourself any favors. There is a whole lot of other bits and pieces in a whole protein food. An egg is another great example. An egg is a whole protein, but it has other bits and pieces in there too. It has phospholipids, and it has great fats, and it has albumin, all sorts of things other than the protein itself. So, protein powders lack all those extra nutrients, is my point. The amino acid supplements. Now, if you go to any sporting nutrient health food store, you will see all of the amino acid supplements. And they are sold to improve athletic performance. And yes, professional athletes do use these supplements. There's the suggestion that supplementing specific amino acids in isolation may offer effects that you can get from food. So they're saying here, if we give athletes certain types of amino acids on their own, we can enhance performance. That's why they're doing it. But single amino acids don't occur naturally in nature. So you are playing around with food here. And it's not highly recommended to do this. So you'll probably find most nutritionists and naturopaths will not be suggesting single amino acid supplements. However, we're not in the fitness industry. Amino acid supplements are often self-prescribed. You can just walk into a health food store and buy them, but can be a little bit dangerous if used in high levels or used over a long period of time. Single amino acid supplements increase the demands for, we'll just keep it really simple. If you have too much of one amino acid, you've got to up all the other amino acids, and that's how nutrition works. You can't single something out because then you need more of everything else. This is a problem. Now, the high-dose branched-chain amino acids are the ones that bodybuilders love. Okay, now what they may not know about that is it can increase your plasma ammonia levels, which is toxic to the brain. So, again, very good for short exercises, but not good long-term. Now, not everybody has the education to know this. There's some more reading on issues of diabetes and protein supplements and the aging process in older men and women. Okay, so how do we assess the protein status? If we identify that there's a problem early on, we can intervene for those people who are at risk. So when we do an assessment, we go, okay, this person may be protein deficient. So, do they have edema? Have they had weight loss? Have they had muscle wasting and subcutaneous fat loss? And that is because the connective tissue is also made out of protein, which is underneath the skin. We have specific tools called the Subjective Global Assessment. So if you go and work for World Vision, the World Health Authority, you're going to have to know about SGA. And I've spent some time on health projects in India, and one thing I do see the doctors do with children is carry around a tape measure, and they measure the mid-upper arm circumference, so around the biceps. And if that circumference is low, they automatically say this child is protein deficient. There's also a little machine called a dynameter to measure the hand grip strength. So if there's no strength when you clench the fist, that's also a sign of protein deficiency because we've got so many muscles in our hands. And then in the biomedical world, we can take a blood sample and measure your albumin and pre-albumin, which are one of the proteins in your blood. We can look at your nitrogen balance, which is in your urine, and we can look at other markers. So we've got your retinol binding protein, which we can measure, transferrin, cholesterol, your CRP, and your lymphocyte count. These are all proteins except cholesterol. Okay, cholesterol is a fat, but it is transported by lipoproteins or fat and protein molecules, which we talked about last lesson, which are the taxi service for cholesterol. So cholesterol itself is not a protein marker, but it is a marker for the amount of lipoproteins that you have. So that because proteins are so diverse in the body, we can have a look at so many different measurements to see if there's enough protein. So don't forget your post-class activity. Okay, and to summarize today, we looked at types of proteins, how they're categorized. We looked at how we categorize amino acids, how proteins are structured. They have an amino group and an acid group and then a side chain. How they're absorbed, which foods we get proteins from, the recommended daily intakes and why we use protein in diets. Then we looked at deficiency signs, toxicity signs, and how we measure them. Now next time we're going to have a look at proteins part 2. Now we're going to get heavily into amino acids. So you're going to be amino acided out over the next 2 or 3 sessions. But it is really important. Vegetarians, vegans, hang on there. Hang in there. It's okay. It looks as if this is a a meat dominant part of these sessions, but protein is a really important part of meat and dairy. But we are going to look, don't be alarmed, we are going to look at all the different amino acids in plants as well. So please stay tuned and hang in with us.